to your septum or nasal thing. Yeah?
But it happens when my nose is blocked.
Correct. That is there. That can happen. That's the ENT, the relation between the three. But still I'm saying there could be...
So should I do some more hearing tests or something?
Let me have a look at your scan because my assistant, she told me that you're having problems with the scan. Let me see what's happening with your nose first. I don't do internal ear or any ear surgeries. So but I do all those things. So I'll tell you the nasal part and then I'll advise you what you can do. Come here maybe once, I'll just also check what's happening inside. But have you had any surgery at all till now? Nothing. Right. With regards to your blocked nose, can you tell me more? Like, is it blocked all the time, or do you have periodical blockage?
Very strange. Sometimes this nostril, sometimes this nostril. Sometimes I feel like in the breathing, but it's like I don't know. It's not like.
You still feel there is some mechanical obstruction to your comfortable breathing.
Yeah.
So what happens is when you ride, when you do a lot of exercise or something like that?
I run out of breath easily. I've been doing some breathing exercise to regulate that. But still, things are not getting,
Alright, so you have some issues with the turbinate.
Yeah,
The turbinate is hypertrophic. And the septum is not too bad. But in some areas it's a bit too thick. See here, this area also is thick. This side, airways go this side. This is hypertrophy.
the sinus, everything is okay.
Sinus as well.
Some polyps also.
Yeah, it is there. But that's not going to cause your...
That's a normal,
Not normal, but that's not going to cause a breathing issue.
I have some halitosis on the back.
Halitosis. Okay, now, so your main concern is a functional issue. You're not bothered about any aesthetic change of the shape of the nose or anything. In which case, you've also already tried a lot of non-surgical treatment for this,
Yeah.
or you've not tried?
Gelinity, all those.
All you've tried. So then the only option is surgery. I will not recommend turbinate surgery. I think we can still do a septal procedure and see your improvement. There is another thing that I can tell you that works for patients like you, but unfortunately for that I have to do what is a rhinoplasty, which is a term for a cosmetic nose surgery. Now let me explain why I say this. The nasal wall has two. This is the external wall and there is an internal wall. So if you pinch here, if you just try, pinch there, just the top of the pinch.
Where the bone is there.
No, between the bone. You feel that is obstructing your breathing. Can you see? Just the top of the pinch. That is the place of the internal wall. Internal wall is a place between the septum and the cartilage, upper lateral cartilage. That we can create extra space there by increasing the so-called the internal wall. But in order I do that, I'll have to do what is called as a rhinoplasty and not a septoplasty, which means I'll open up the nose and get to the septum, remove that part of the septum that's a little bit deviated. I don't like to do work on the turbinates because that has some other issues like an empty nose syndrome, other issues. That's very dangerous to treat. So my philosophy is we don't generally, in your case, we avoid it and it works without touching it. It's always.
Because sometimes both my nostrils are blocked. So
that's when we are worried. If one is blocked, it's alright. Most of us have a nasal cycle, then one blocks and the other opens and vice versa. That's not a real concern. So I'm worried about when both are blocked. So we will be able to solve that by working on the internal nasal wall and also by working on the septum. So by doing these both procedures and by seeing your scan, and I think you should get, I can give you a 90% assurance.
So it's a minor issue. So will there be work on the bone, this bone drilling?
No, that we won't do. No drilling, not required. This is not a cosmetic procedure. We have to use the approach of cosmetic procedure through the functional treatment. But we don't have to do anything much to change the shape of your
So does
nose.
it reduce my back breath issue?
No.
That's something.
May not. But it definitely solve your breathing, your block, and also the fact that when you run or when you exercise, you say there's some difficulty in breathing. That should be solved.
Yeah.
That should improve. I mean, when I say solved, some patients, even after it's done and everything, they are like, Doctor Saab, improvement to ho gaya, but pura ठीक नहीं
Not how much I want to.
That can happen once in a while because this is long standing and sometimes the hypertrophy is because of an allergy and it's a functional issue. I'm seeing all scans and I'm trying to solve the functional issue. So yeah, a lot of experiences there, but still that could be there. That there is a lot of improvement, but still you might feel it's not perfect. A few patients do say that, but there's a good chance that you would be like, I'm fine now. This is not bothering me anymore.
And one more thing, my right jaw here, sometimes, I did some orthodontic work.
Okay.
They said it will become alright, but when I open my jaw fully, there's a like small
Clicking.
Yeah.
But on the scan, there's nothing abnormal. I would just recommend you to ignore, apply some Ayurvedic oil.
There's no pain, nothing. I just ask you.
Ignore. No treatment.
And one more thing, my flare nostril, I don't know what you call it, in between, that's like a part.
Yeah.
So that you said you will strengthen something.
So when I do the procedure, that will get strengthened.
Oh,
The
so
breathing
you
part.
put some extra setups?
No, not there. We put here.
Oh, this is really important. Okay. I was thinking it will be over here.
For that, then we'll do rhinoplasty if you want.
No, it's all depending on what you say for the best functional.
So see, now whatever I told you is for the functional aspect. While we're doing a functional aspect, if for example you're desirous and having slight improvement here, slight improvement in the tip, we can do it. Otherwise, just leave it.
Whatever helps me in my breathing, I'm okay.
So that's what I've suggested. I've not suggested anything else for you till now.
So this flare, flimsy nostril thing is not an issue.
That's not the issue.
Because I had communicated with you on WhatsApp. That time you asked me to send a video and then, but when this is what we're talking about.
That's what you get an idea when you do the how much to find the blocking is or whatever. All those things basically gives an extra idea because I don't see you in person. But now we are very much more clearer. Anyway, this is not an emergency also. So it's not something you'd want to do like maybe tomorrow or the next week. You can delay it.
So this issue about this hearing,
No, that will not be related. See, when the nose is blocked continuously, then there could be a ear connection. So what I will recommend is, since there is a problem with the nasal apparatus right now, since you've been carrying this for several years now, you might as well get this sorted. Before that, get a ear consultation also.
Because I remember one of the doctors said we will drain out because there's an extra fluid here, we will drain out while doing this.
So that let them do first if they want to do. I don't want that.
This is more important, but as part of that, this drain out also.
We can call my ENT also for the ear if you want.
So you want me to go to Chennai and I will consult and then...
Whatever. And then when you come here, eventually if you do come for the nose, my ENT will also come. He can also have a look at the ear and suggest what can be done. But maybe most of the times, when you have a blocked nose, it can affect the ear.
It affects so many things, you get anxious.
Yeah.
So a lot of things it
affects sleeping for a lot of people.
Sleeping, yes.
There are
I don't get dreams, it's a weird sleep pattern. And once in a while I sleep well, I get lots of dreams. Good dreams, everything is different on my nose.
Yeah. I'm not sure that's correct, but yeah, anyways. Alright, so
and I have to stay here for a week and then 1 week I have to stay at home. That's the
each
issue.
profile is in your case.
I have to check with the manager and I can
No issues.
I got to enjoy and get the...
Easily. Get our appointment like when we are free and also when you can get time off your work.